A cage, she said, to stay behind bars until use and old age accept them, and all chance of doing great deeds is gone, beyond recall or desire. Hi, I'm Frank Speidel, retired emergency physician and recovering hospital administrator, and welcome to The Doctor Is In. In this show, with the help of guests, we explore healthcare in the U.S. and its interface with society. Now, I am neither an infectious disease specialist, epidemiologist, nor a public health official. For guidance and healthcare decisions, I recommend you consult your primary physician, your state and local health departments, and the CDC. As I wrote today's script, we have lost over 889,000 Americans to the COVID-19 pandemic. We have learned much, and much needs to be learned. In the first Doctor Is In episode on the pandemic on March 15th, 2020, I had Dr. George Avedian, medical advisor for Delaware County, as my guest. Now, I am not ashamed of our first exploration of this terrible pandemic. To be sure, I made mistakes. In my first speculations, I thought COVID-19 would end up looking like a bad seasonal flu epidemic. I had company in this belief. Professor Paul Offit, the giant from Children's Hospital, and the enduringly ubiquitous Dr. Anthony Fauci of the National Institute of Allergy and Infectious Disease expressed the same views at the same time. We were wrong. Sadly, we were very wrong. But at The Doctor Is In, we were also right and ahead of the curve about some things. In our summer 2020 show, we observed that COVID-19 carriers could be asymptomatic, and this would lead to asymptomatic transmission. We also observed that the CDC had made a faceplant on testing. One of our early guests, who wants to remain anonymous, made the off-air observations that the pandemic would be made worse by coinciding with an election year. The guest observed that the elected officials would follow Rahm Emanuel's recommendations to not waste a crisis. I invite you to remember the thunder as elected officials declared their intent to crush the virus. Big Brother visages hectored the public in this war on COVID. Keep 6 feet separation and wear masks outdoors when you play soccer. Even now we hear, we thought we had COVID-19 on the ropes, ready to deal a clean knockout blow. Anonymous bureaucrats soon became common names and faces, anointed as saviors despite prior failings and continuing missteps. The CDC declared that only its tests could be used to identify COVID-19. The CDC then distributed its tests, and they didn't work. Dr. Scott Gottlieb, the former FDA commissioner, documents and catalogs this and other missteps in his September 21st, 2021 book, Uncontrolled Spend, well worth the read. A fair reading of Gottlieb's book confirmed my sense that the CDC, as an agency, while not always right, is always in charge and never in doubt. Nor are the concerns about the performance of the CDC and public health in general limited to healthcare professionals like Dr. Gottlieb. Public health concerns have erupted in lay publications. Who would have thought the competence of public health would be front page of the American Legion magazine? Not to be left behind in questioning the competence of public health in the CDC, the Atlantic magazine weighs in too, headlining, CDC's flawed case for wearing masks in school. Sadly, this hubris is not limited to the national level, but extends to local governance, from buying the wrong test to creating arbitrary standards to prioritizing all county employees ahead of 65-year-olds with emphysemas for vaccination. Local governance has embraced the great Oz has spoken school of public health. Our public discourse now bristles with name-calling and denunciation. Disagree on medical or science literature and one gets denounced as anti-science. An aside, I was awarded by college's undergraduate prize in physics, and I was a physics major as an undergraduate. I have done multivariate regression modeling in grad school, yet now I am labeled as a science denier. To share Dr. Kurtz's comment, the horror. Censorship has now become the coin of the realm. Remember Facebook censoring speculation about and explorations of the lab origins of COVID-2? All in the name of weeding out misinformation. Questioning needs to be censored. Tell that to Charlie Brown. A wonderful meme has appeared. Trust the science is the most anti-science statement ever. Questioning is the science is how you do science. He's in good company. Richard Feynman quotes the same thing. Questioning is what science is about. Perhaps I have had one too many email exchanges with those who cite Vox and Fox News as scientific sources. But I am concerned we have entered a new dark age of intolerant certitude. A reign of terror by the smooth cortex said. Daily information broadcast by the commentariat with their degrees in pseudo-studies fuel this foolery. With a healthy skepticism about my own observations, I am honored to have as my guest Mr. Rick Anthony. Mr. Anthony is a massively successful serial entrepreneur. But more importantly, he is a sensitive, caring man of sparkling wit, insight, and judgment. Qualities in short supply in these days of sound and fury. And most importantly, he's from Frackville, Pennsylvania, as are the Speidels. Rick, welcome. And what did I get wrong?
First of all, I didn't recognize myself. You're going to have to use you every time I speak anywhere. Thanks for the introduction. You didn't get anything wrong. In fact, you're spot on. As a specialist consultant specializing for over 40 years in organization and leadership communications, my perspective on the events of the last couple of years has been on the effectiveness or ineffectiveness of how the coronavirus pandemic has been communicated. And my assessment is it's been miserable, right up there with the Catholic Church in terms of how it's communicated some of the issues having to do with the faithful. The institutions, government, healthcare, science, public health, and of course the media all get an F for their attempts to communicate or disseminate information. They've done it horribly, and they've caused resentment and chaos, fear, all of it leading to a sense of abandonment on the part of people, and getting to the point where the elitists are forcing what they call patriotic compliance. We're in a bad way right now, and from a communication standpoint, I don't see it's going to get any better, particularly when we just learned that the head of the CDC is going into for communications training. We don't need a leader who's got training wheels on to communicate about something that's affected us and the rest of the world. It's horrible. Other than that, they're doing just fine.
Our country has seen worse times, but I sensed our values were stronger in other times. Am I wrong about my concern about an erosion of common values on top of the communication flailings we're seeing?
No, I think, again, you're spot on. I'm losing my voice a little bit, Frank, so I think I need a doctor. I think the counterculture movement of the 1960s rejected every institution, every tradition of the previous generation, and instead embraced diversity, equity, and redistribution of wealth. The result has been that individualism has been replaced by collectivism and a pernicious sense of entitlement. We're on a dangerous, slippery slope that I believe is going to lead to economic and moral bankruptcy of this country unless somebody does something. And I don't see anything on the horizon to stop it. As a father, a grandfather, a great-grandfather now with 6 great-grandchildren, I'm really concerned about the future for our kids and their kids.
I have to share with you, Rick. There was a time when we accepted different opinions and we wanted to understand what was being said. We embraced and celebrated people being different. I'm a child of the 60s, and I thought it was refreshing to see that people could dance beneath the diamond sky with one hand waving free and be their own selves. And I thoroughly enjoyed that. Somehow, I see we flipped those values from accepting and embracing and tolerance of other individuals to now we have descended into a time where it's what group you belong to. It is things that have nothing to do with what you are like as a person. So enough of that monologue from young Frank here. We're struggling and swirling. This started with the 60s, but has there been recently a tipping point where things have gotten dramatically worse?
I have to leave it to the historians and social scientists to try to identify a tipping point. But I think, as you just indicated, most of the folks who are at least of my vintage, and I predate the 60s by a few years, would agree that it was the change, the drastic change, the throwing off of everything that we had known and cherished and previously in favor of this new liberalism and freedom. Change isn't all bad, certainly, and change is necessary to perpetuate life. Extremism, however, is bad, and we've seen it in all forms. Societies go through periods of harmony and dissonance. We're now in a period of destructive dissonance, and there are various factions now competing for dominance. And in the case of COVID, they're using COVID to try to leverage it for power. It's so evident, and most people, I think, see it, but feel helpless in how to stop it. But somebody will sometime soon, I hope.
That goes specifically, Rick, to what one of my guests had said early on, off record. He didn't want to have this attributed to him, but he was scared that the COVID pandemic would be used to consolidate power to build kingdoms.
Yes.
That playing on people's fears would be used as a lever to increase kingdom, to increase control, and to satisfy the very infantile desire for power. I started the program with a quote from Tolkien, and Tolkien wonderfully riveted on the danger of this desire to have power, to control things, to be in charge. It's very seductive. It is very seductive. It is the kind of thing that we have to guard against, I think, and fight all the time, this desire for power, aggrandizement. And I think that this is unleash the tiny golems that exist everywhere in our society. And they exist in young Frank here too. I have that tiny golem inside of me that I like power, I like the attention. So you had mentioned in your first response about the problem in communication. Cleaning up communication, is that part of the solution? And let me add to that, maybe communication with ourselves. I've often felt when I've sat and listened to somebody that I wanted to say, well, hold it, what's the goal of this plan of action? Have you really thought and talked among your own quiet mind about what you want this to do?
Yeah.
Thoughts, comments?
Communication, effective communication, is certainly part of the solution. When I was teaching courses in organizational leadership communication at Villanova University, one of the points that I would make early on is one of the purposes of the course is to teach you to be discriminating, to value and make assessments about all the information, all the data that's being thrown at you all day long, and filter it through a series of filters that you can develop so that you're not susceptible to everything everybody is saying about just about everything. And so they form your opinions. Be discerning, be discriminating in what's coming at you so that you can formulate your own ideas, your own opinions, your own thoughts about all of the issues that are so important to us in our day-to-day lives. But effective communication is very complex and requires very strong leadership. And we have a conspicuous absence of that at all levels today. My definition of effective communication is right out of the book. It's a sharing of information in an environment of mutual trust and respect intended to change or reinforce attitudes to affect behavior to achieve measurable, specific goals. try to apply that definition to anything we've heard, any experiences we've had over the last couple of years, it has not been purpose. If it has a purpose, it is, to go back to your earlier point, to gain more power, to create more fear, to create more compliance among 350 million people. And so far, it's been working until recently. Thank God. We see pushback, we see resistance, we see people are finally waking up and saying, wait a minute, those people aren't really any smarter than I am. I'm going to use my own good judgment in deciding what I'm going to do, whether I'm going to do it, and when I'm going to do it. My wife and I got the shots early on, as well as the booster. We consulted with our primary physician, and his advice was, given our age, frankly, and given some underlying conditions, it was probably advisable that we got the shots. But we made the decision. I know people, including some of our grandchildren, who have resisted getting the shot for their own good reasons. So we have to respect that. And they're willing to take the consequences, whatever they are. On the other hand, we don't know what as you know, as a physician, we don't know what the long-range consequences of the shots are. Perhaps we should be living in fear that tomorrow a limb is going to fall off, or we're going to get some dreaded disease as a result of following the advice of the experts, whoever they are, and getting the shot. Dr. Robert Malone talks about, I'm going to fumble the phrase, but it is mass information hypnosis. But his point is, we are at a point when a society gets to a point where people are so confused, so fearful, there is so much chaos, they're vulnerable to anyone who steps up and says, I'm the leader, listen to me, I have the solution, or any event or series of events that give people comfort. We're at that stage now. We've been listening to all of the experts, among them, and principally, Dr. Fauci, who started out as a hero and is now the poster child for bureaucratic, authoritarian, elitist obfuscation. He has to be removed. That's my opinion, but not just my opinion, but the opinion of a number of people, because we don't trust him anymore. And trust, again, going back to my definition, in an environment of mutual trust and respect. He doesn't trust us. He doesn't respect us. He's a bureaucrat, pure and simple. That's my opinion.
For me, he is the poster child of the great Oz has spoken. Back in '94, the CDC drove an initiative to require N95 masks for people that would be dealing with tuberculosis patients with tuberculosis. The reasoning being for this was they were concerned about the spread of multi-drug resistance tuberculosis. And that's a reasonable concern. They recognized that the tuberculosis bacterium, which is a big bacterium, it's about 2 orders of magnitude larger than the SARS-CoV-2 virus, was transmitted by aerosol. It was in the air we breathe. And for that reason, they were pushing N95 masks. Now, there's a challenge of that. If you work in an emergency department like I did, you don't know who comes in who's coughing has got TB, which means that you're virtually going to be wearing an N95 mask for your whole shift. This never came to fruition, but it was an initiative by the CDC, and it was undoable. It highlighted kind of the trade-off that people make between a benefit versus the cost of that benefit. I've mentioned this because we are talking about communication. Back in '94, the CDC knew that respiratory pathogens were aerosol spread. It took the CDC till the summer of 2020 to even put that in writing that, oh no, it's not droplet. Droplets may spread, but it's an aerosol transmission. And Dr. Fauci, I would think, would know that aerosols are not blocked by those little cloth masks we wear. I'm sure he did. And I think you're seeing now the CDC has moved to saying, oh, it ought to be an N95. Thank you. Thank you for coming late to the dance. His credibility has been hurt. I suspect, I don't know what's driving him, but I agree with you completely. The lack of confidence expressed in many forums for his ability to give direction is crippling us right now. And you sort of touched on something else that leads to my next question. How does a layperson know what to act on, know what pronouncements, and there's no shortage of pronouncements out there. How can a layperson sort out what to believe and what not to believe? I always say, listen to the CDC. That's the only organization we have that's got the real platform.
Right.
But I don't have a lot of confidence in some of the things they've said.
You have to be suspicious because they've shut down all opposition, every dissident opinion. What I've been doing is listening to the outliers, the Dr. Malone's, Dr. Peter McCullough's, those who have been against mass mandated vaccinations, and particularly vaccinating young children. These people have been shut down. They've been banned on Twitter. They've been banned on LinkedIn. When the government and others make a conscious effort to shut down opposing opinion, you have to be suspicious. Maybe they have something, and we should be listening to it and making our own judgments. We have to reaffirm our right to decide for ourselves. We have to assert ourselves peacefully. I'm not suggesting we protest and walk down the streets with banners and so on, although that's probably not a bad idea from time to time, just to get their attention. But we have to assert ourselves and take back our right to make our own decisions and our right to question without fear of repercussions, without fear of recrimination, without fear of being put in jail or being labeled as something that is terrible, something is fearful, something that is undemocratic. That it drives me crazy when all of them talk about protecting our democracy. It drives me crazy when they talk about misinformation and the people who are responsible for misinformation. They're responsible for misinformation. You talked about masks. I don't know what kind of mask I should be wearing right now. I have the cloth masks. I have the other masks. I've got NK95. I've got an inventory of different kinds of masks, but I don't know which ones will work. And then they come out and say, some people, masks make no difference at all because they don't prevent the transmission of the coronavirus. The others, as you know, others are arguing, and I agree with them, there should be more attention paid and more resources committed to all of the therapeutics. Where are they? The other idiocy is they talk about tests, but there aren't any tests. And then I read in this morning's paper, you have to be sure of the tests because there could be a false negative. Well, what's the tests? I've tested myself and I've come up with negative, thank God. But now they tell me, maybe not.
We need to be aware of the sensitivity and specificity and the limits of these tests to give us a definite answer.
Well, then why promote them? Then, Frank, why promote them? And why spend bazillions of dollars now for tests that are going to be in the hands of millions of people who have been told probably a good idea to have the test and use the test, but don't count on it.
You highlighted this tendency to censorship and to controlling what people hear. A long time ago, 17th century, a blind poet, some guy by the name of Milton, wrote an extended essay called Areopagitica. One of the more interesting titles for an essay I think I've ever read, but he talked about the dangers of a priori censorship, of blocking ideas, and even censorship in general. And he advocated something that I think is a cornerstone of a successful society. And that is the antidote for bad speech, for confused speech, for speech that is wrong, is not less speech. Mm-hmm. It's more speech.
Yes.
It's giving all ideas a voice in the marketplace and let informed people weigh and judge what is true and what is not true. That's dangerous in some ways, but it's more dangerous when you have one person or a group of people deciding what people hear. You're a get things done activist. How do you recommend, what should we do going forward?
I've already indicated that one of the things that I think is very important is that we reassert our right to make mistakes, if that's what happens. But it's our right. And we have to reassert our right to speak and to have different opinions without being in one another's throats and putting labels on one another as bigots because we don't agree or they don't agree with us. We've lost that in this society, and it's a really bad condition because I don't know how to come back from it. We're so divided. We don't trust anybody. We don't trust any institution. We don't trust any of the institutions we relied on in the past. And in the past 2 years, all of the major institutions, most especially the media, have given us ample reason not to trust them for sources of information that we count on to make life decisions. That's scary. That's really scary and puts an entire society in danger. As I said, I think we're on a slippery slope. I don't think there's a simple answer, Frank, to what an individual can do. Having said that, I was contacted last year by a woman who lives in Montgomery County. Her name is Elena Fishbein. And she was unhappy with what was happening in the schools, partly as a direct result of COVID and remote learning and so on. And she single-handedly stood up at the risk of threat, which she had, vandalism to her home, which occurred, and has, as a result, created a nationwide organization with chapters in all major cities for an organization she's created called No Left Turn in Education. She's marvelous, and she's one of many now who are standing up. Of course, this is the case in Virginia. All the challenges that are in the courts now, challenging the mandates for vaccination, particularly for children. What's happening in our schools, the list goes on. You're familiar with it. You may have a better idea than I, but it seems to me that we begin by remembering that we have rights in this country and that we have an obligation to assert and reaffirm those rights if there's any hope of our taking back our country away from the elitists, the bureaucrats, the people who claim that they have the truth.
I always love talking to you, Rick. You grow me, you challenge me, and
I just babble on.
No, you don't. I delight in the fact you're willing to be different, and we need to encourage people to have their own voices, to speak out. You mentioned liberals. In some ways, I'm the old classic 19th century liberal. The true meaning of the word liberal, the concept of freedom for individuals. Individuals have freedom, and that's why we have government, to secure our liberties. In closing, I began this program with a quote from Tolkien's Lord of the Ring. Eowyn was asked what she feared, and she said, "A cage to stay behind bars until use and old age accept him, and all chance of doing great deeds is gone beyond recall or desire." I want to close this program by asking, inviting us all to question the cage and bars that we may have been making for ourselves, and if it's to our advantage. Be safe out there, and thanks for watching The Doctor Is In.